Good evening, everyone. My name is Omolara Ishola. I'm the host of Possibilities Divine. And the focus of Possibilities Divine is to foster and build godly relationships. And we know that a wholesome person is able to have a wholesome relationship. Tonight, we're focusing on a very significant aspect of our well-being, and that is our mental health. And I understand that life in 2020 has been extremely interesting, and we're still experiencing a pandemic, and life has not been what it's always been. One of the significant areas that have been affected by people's lives is their mental health, whether directly or indirectly. And as Christians, we tend to shy away from certain things. Mental health has a stigma to it. Somebody who has high blood pressure will not feel stigmatized. Somebody who has malaria or fever or anything will not feel stigmatized. But somebody who has mental health will be afraid, will be embarrassed, will be ashamed due to no fault of theirs, even to share that. Tonight, I have a guest who is knowledgeable in the field of medicine, specifically mental health. She's a psychiatrist. And tonight she'll be sharing knowledge with us because knowledge empowers. And I'm glad for everyone who has joined tonight. And I will invite you to send in questions now so that as we go on, our guests will be able to take questions. It could be a friend's friend who's asking that question. It doesn't have to be you asking that question, but whatever question you may have regarding depression or mental health challenges, I want you to put it in the chat so that we can ask our guests. Tonight with me is a friend, a sister, a medical practitioner, a child of God, and that is what makes all the difference. Sometimes when you go to somebody who has no idea, who has no understanding of what it means to be a person of faith, they are not able to adequately capture or answer your questions or see things from your perspective. But tonight I bring a woman of God, a child of God. And I'm excited to have with us tonight Dr. Omotola Adekonde. She will be our guest. Please make her feel welcome. Thank you so much. Sister Tola, over to you. Welcome.
Okay, thank you very much, Sister Lara. It's really a pleasure to be on this platform and to share with people, to educate people, to share and as much as possible allay anxieties and make people free to realize that their mental health is definitely part of their well-being, not just our physical health. So like Sister Lara said, I'm Tola Adekonde. I'm a psychiatrist. I practice out of Oakville Hospital here in Oakville, Ontario. And I enjoy psychiatry. I enjoy what I do. So this is really a pleasure to be here. So today we're talking about seasons and depression. And I just would love to clarify what depression is. And it's such a very loose word that we use sometimes because it can be part of our daily vocabulary. So sometimes it's not easy to realize that depression can be an illness, and any illness needs to be treated one way or the other. So when we talk about depression in terms of our mental health, the formal term we use is major depressive disorder. And it's not just about feeling sad or feeling unhappy. We're talking about being totally unwell in the sense that there is loss of functioning, there is you're not able to be your best as much as you would really love to. So a depressive disorder means that there's persistent sadness lasting for at least 2 weeks. So it's not just feeling happy today or feeling sad, on some day. The criteria we use is that it has to last for at least a 2-week period in a certain time. And there has to be impairment in function. And that means that, say, for example, you're a worker, it's impairing the way you work. You're a mother, it's difficult for you to care for your children the way you've normally done. As a child or as a teenager or as someone in school, it's difficult to continue to be in school the way you would really love to. So that the impairment in function has to be there. And we usually say, okay, well, with depression, it's not just a state of, being, in the sense that this is how it is. There's certain criteria, there's certain symptoms that you have to have for a doctor to diagnose you with clinical depression. There are other forms of depression as well, apart from just major depressive disorder, like I mentioned. There's seasonal affective disorder. For some of us are living out here in areas where we have weather as seasonal changes of weather. So some people find that when it's winter time or when it's the fall time, then they begin to experience depressive symptoms. And once the weather changes, they're fine until the next winter. Then it becomes a problem. And it's not just your normal like winter blues that most people face when it's cold, but then they have all those symptoms of depression that I'm going to talk about. I've seen a few patients that paradoxically, their seasonal affective depressive disorder comes on in the summer. So in the summers, they experience a depressive episode, and once the weather changes, then everything is fine. So it's a recognized disorder. There's also postpartum disorder, depression for ladies sometimes, when after they give birth to children, maybe the first few weeks of after having their babies, because of hormonal imbalance, they experience very significant depressive symptoms. And, it needs treatment. It's not just something that you can talk people out of. They need to be treated maybe with medication or with psychotherapy. And of course, there's dysthymia as well, which is like persistent depressive symptoms that, just kind of goes on and on, although the patients can able to function, maybe go to work, but they are still really not their best. So most times when people have depressive disorders or depression, they come in episodes. Say, for example, it lasts for a particular time, and then after it's treated, it goes away. And unfortunately, when maybe there's another trigger, something happens, then they have another depressive episode. And sometimes it's just kind of out of the blue. They don't even have any triggers, and it just kind of comes on that way. So with depression, like I said, there's certain symptoms we watch out for that help us to know that, okay, this is clinical depression, and it's not just, oh, you are not happy, snap out of it kind of unhappiness. So the core symptoms would be like the person is low, sad, they just don't have any energy. And like I said earlier, it lasts for maybe a 2-week period. They don't have interest in things they used to enjoy previously. Say, for example, if they were into sports, or they had a hobby, something that makes them, kick off, something that makes them happy, they just lose interest in that thing. And then sometimes, they are not able to sleep well. They don't sleep. They want to sleep, but they just can't fall asleep. And there are some people that, which is when they're depressed, that they sleep a lot, especially people with seasonal affective disorders. You find that that's when they will be, they'll sleep for maybe 13 hours. Sorry, excuse me. They sleep for like 13 hours continuously. It's difficult for them to, to function. And that happens sometimes even in teenagers when they have depressive disorder. You just find out they're just always sleeping, and you wonder what's wrong with this child. Then also, even the appetite can be variable for people with depression. Sometimes they just don't have the appetite. They are not hungry, they lose weight, and then of course that leads to weight loss. And then you have some people, it's when they're depressed, then they eat a lot, and maybe like comfort eating. And that also happens with people with seasonal affective disorder as well. That's when they crave like carbohydrates or sugars, and they just keep eating and eating, the hunger is just persistent, And then for some people, especially with children, because children can also suffer from depression, you find out that they're just more irritable, and teenagers and even men, when they're depressed, they're very irritable, they're very angry. Whereas some people will just kind of crawl into their shell. They don't want to talk to anybody. They're very sad. They can't function. Sometimes it's even difficult to motivate themselves to get out of bed and do things. And then unfortunately with depression can come like feelings of worthlessness. You feel worthless. You feel like, the self-esteem is just gone. You're not, you don't feel good about yourself. You feel, maybe sometimes people look at themselves in the mirror, that's when they begin to see faults. And then they just don't like themselves. And that makes them even feel sadder because they're just not happy with what they see or how they feel. And then they feel very guilty. It could be just something they've done that has happened maybe years ago. Then they start feeling guilty about it. Oh, why did I take this decision? Why did I do this? And people around them are wondering, oh, you should have forgotten about this particular incident, but it just keeps coming and nagging them that, oh, you're very you're very bad, you're not a good person, you're not a good mother, and they feel so guilty about things that are just maybe to the ordinary eye looks so unnecessary. And then of course the concentration is also a problem for people when they get depressed. Like maybe they try to read, they can't focus. It could also be, apart from even reading books or magazines, you could also even be watching a movie. You're just sitting there watching the movie, and after the movie is gone, you can't even say what happened because you're just sitting there. You can't focus. And sometimes when people are talking, they get easily distracted, and they can't hold a conversation for too long. So not all of this happens in one person. I'm just saying that, you need at least 5 of all of those symptoms that I have described to be able to, say, okay, this person has clinical depression. And then for children, that's when the school performance goes down. They're not, maybe the child that was scoring 90s, now scoring 60s, and you can't really explain what's going on. And they kind of keep to themselves. They're not their bubbly self anymore, And of course, for elderly people, they can get a bit more confused. They're forgetful. They can't, they can't really do what they used to do before. So all of these are things that are pointers. And if we know the symptoms, then it helps us even, when you're with your loved ones at home, you can easily pick up things that, oh, this is not going right with this person. And, it's easy for you to be able to identify and help them, because there's some of these symptoms that might seem like, oh, this person is just being lazy. Say, for example, you have a teenager that is just in bed for hours and hours. You just kind of feel that, is this child just trying to avoid school or avoid chores? And then instead of, trying to help the child or help the person, then you are maybe criticizing them the more. And then, of course, they feel bad about themselves. So it's very important to recognize these symptoms. And unfortunately, what we have like mild, moderate, and severe depression. So for mild symptoms, they're just things that maybe we could point to a few of them in this category, but then they're able to function. They still go to work. You can still go to school, but then you're just not yourself. Then of course, as things become more severe, it's even going to be very difficult to function, with this, with having these symptoms. And of course, when it becomes very severe, one of the things to watch out for is the person starts wishing that they were dead. Sometimes they just wish, what am I even doing in this world? I wish, I wish I was not here. And then when it gets more severe, then they want to really, really kill themselves. That's when you hear of people taking an overdose or trying to hang themselves or trying to, that's very extreme. But this, unfortunately, can be a symptom of depression. And then, unfortunately, things go wrong for people sometimes. So in the event that they try to commit suicide, things might go wrong. They don't die, but then they have like a brain damage, or they get complications of whatever they've done. So depression is a very serious disorder, and it's something that definitely we need to be aware of. And the earlier it's treated, the better. Because unfortunately, when you have mild depression and it's not taken care of, there's a tendency that things can get more severe. So the earlier the symptoms are caught, the earlier it's treated, And one thing definitely that causes a lot of people to not seek treatment is stigma. Because especially for us with the African background, we feel that, oh, why would you talk about depression, or, as if you're admitting defeat, especially when you're a Christian, then you feel, oh, you're not being positive enough, you're not being, you're just not being a Christian enough by just admitting that you have depression. But we should realize that even the Bible, when we read the Bible, you see a lot of times that the Bible, people, even in like people of old, like Jonah, will talk about when he was in the belly of the fish, the anguish he went through. And then, of course, we have someone like Job, who lost everything. And at the point in time, he was really, really lamenting, and you could see the agony in what he was going through. So these are normal symptoms. Even when Jesus was about to be, crucified, we could see that. I mean, the times he said, "Oh, let God, I wish this cup would pass over me." And, there were times that, these are emotions that people feel. So we shouldn't feel that, once you feel low or once you feel depressed, you're not good enough and you can't access help. So, and of course, when you look through the Bible, you see that the Bible recognizes that these things happen, and we are encouraged to seek help. We are encouraged to get out of that position, because it's not going to help us to be productive, as in many ways. And then as we talk about depression, there's also adjustment disorders, and adjustment disorders occur for people when they have like a very significant life change. Say, for example, there's relationship difficulties, finances, and, it's difficult for them to cope, and most of the times, once that stressor kind of go out of the picture, things get better. So that's how you kind of differentiate the two. And for most people with adjustment disorder, it usually resolves within 6 months. Unfortunately, with depression, for some people, it can be a pattern that goes on and on. It becomes recurrent over the years, and it could last longer if it's not treated. So, like I said, the depression is a biological illness. We normally look at, if you say, okay, what causes depression? There's not one thing that we can say, oh, this is what has caused it. Like, like in other medical conditions like diabetes, that, oh, when your insulin is high, when your insulin is low, then this happens to your sugar, and that's it, But with depression, we have what we kind of describe it like a multifactorial base, into the sense that you have the biological cause, like some people are just genetically predisposed. So it can definitely run in families. Unfortunately, some people have a positive family history of depression. It doesn't mean that everybody in that family is going to be depressed, but it just means that you might have a higher risk of developing depression compared with other people. So there's the genetic vulnerability that, this is how it is. There's the effect of like psychological factors like your temperament. For some people, because they're just prone to, wanting to be perfectionists, or they are prone to be very anxious or dependent on other people, it puts them in a very vulnerable position that when things go, wrong, then they become easily depressed, because they are not, the personality structure is quite vulnerable, if I may put it that way. And for some people, it's like, it's just difficult to build coping skills. And anything that, breaks that, maybe then it's a situation whereby, things are very challenging, and they're just not able to cope. And then it becomes a situation whereby they just become very easily depressed, And then some people are just prone to negativity, in the sense that their pattern, the thought pattern is always negative. Like, oh, they just feel, oh, nothing is good in this world. Some people, I'm sure you've met a few people like that they're just very negative people. Unfortunately, they are prone more to depression, and that's why, as Christians, we can even use the advantage we have with the Word of God to be able to build, to build our faith, to build our own positive base, in the sense that your mindset, you're not easily given or easily prone to negativity. And then, of course, there are social factors. Unfortunately, some people have gone through traumatic experiences, childhood trauma, sexual abuse, bullying, all these things predispose people to depression in later life. And for some people, it's just learned behavior. Like they've just learned, maybe they grew up with parents that unfortunately had depressive disorders. And research shows that when a child grows up with one parent with depression, there's a 10% chance that that child can also develop depression, because of they've kind of learned from that parent. And if both parents are depressed, then there's a 30% chance that that child, mixed with the genetic, of course, predisposition, might also develop depression. So, so this, all of this mixed together. And then of course, in terms of the biological base, there's the neurotransmitters. We all have chemicals in our brains. One of the most important one is called serotonin. So when this neurotransmitter in the brain is low in quantity, then the person is more predisposed to depression. There are other neurotransmitters like noradrenaline, like dopamine, so when they are not in their adequate quantities, the person is, can develop depressive symptoms. And that's where the role of medication can come in, like I'll talk about in the future, in the sense that when the doctor needs to prescribe medications, and they then prescribe medications, they do correct those levels of chemical imbalance in the brain, and then that would help the emotions and the mood to get better. So like we see, it's a biological illness, so it's not less than something like hypertension or diabetes or things like that, in terms of medical causes, because there is a biological underlying factor, like I said, the chemical imbalance in the brain. Okay, and then of course we have like the demographics. Unfortunately, women are more prone to depression, like 2 times the risk of depression in men. So if you have like a woman, she has 2 times the risk of being depressed compared with the male, even if they are twins, So, and of course, with the hormonal imbalance that women go through in life, like, menstruation, menopause, giving birth to children and things like that, also predisposes women to have a higher risk of depression. So I know people might also think of like some physical illness, what's the role of being ill and then being depressed, Unfortunately, there's some illnesses like hypothyroidism or even iron deficiency anemia. Say, for example, your iron is low. If they're not well corrected, those can also manifest with depressive symptoms, like the symptoms that I've mentioned. Not necessarily that you would have a major depressive disorder in its true sense, but then you can have some depressive symptoms, like you're not just able to concentrate, you're very tired, you're not happy, you're weepy, and not able to function at all. And there's some other times that you have depressive symptoms come up as a reaction to an illness. Say, for example, if the person has a cancer, which is like maybe the prognosis is so poor, and then, or maybe like a heart attack or something, they can have depressive symptoms as well. And then you have some depressive symptoms that are caused by an illness like stroke. There's what we call like a post-stroke depression. So many times people that have suffered a stroke have a high risk of developing depressive symptoms as well. And then, of course, it won't be complete if we don't mention the role of drugs and alcohol. Alcohol, like we say, sometimes it's a depressant, so sometimes some people take it to cope, like they feel very low and then they take alcohol so that they can get more happy and all. And it happens that way, they get a bit more like pepped up and things like that. But then once the alcohol, wears out, then they become more depressed, and then they take more alcohol to get better. So it's like a vicious cycle with alcohol. And then you have some drugs like cocaine. Unfortunately, cocaine, you can have, with cocaine, people have depressive symptoms with cocaine as well. So these are things to definitely avoid and shy away from, especially if you know that you have a genetic predisposition to developing depression. And of course, 2/3 of the people with depression do have anxiety symptoms. And anxiety, I mean like worrying excessively all the time and not being able to function, then having physical symptoms of anxiety, like your heart is racing, you feel very sweaty, you can't breathe properly. And some people have like full-blown panic attacks with that. So worrying. And then of course, in the situation that we are in now with the pandemic going on, second wave, there's a lockdown, going on, and all of that, causes a lot of anxiety. So even with COVID anxiety, if it's not well managed, then people become depressed because there's so much uncertainty and you have no control. Like, for example, people that are business owners, maybe people going bankrupt, they have to close their businesses and it's of no fault of theirs. They don't even know when they're going to open. A lot of those kind of situations can definitely predisposed to people having depressive symptoms. And of course, loneliness is also something that we need to, as much as possible, even though we are socially isolating. And I've always kind of rebelled against that term. I think they should change it to physical isolation, not social, because we shouldn't really socially isolate ourselves from each other as much as possible. So fine, we need to maintain our physical distances and all of that, but it's very important we stay connected, whether it's by Zoom or by text or, whatever means that you can stay connected with people. It's so easy to say, okay, let me just keep to myself and, not just do things myself. But with all that is going on, especially at this time when, this is a global challenge that we're all having, it is not the time to isolate yourself from people. So as much as possible, especially for people that know that they have that likelihood to be depressed or to just have depressive symptoms, try and stay connected with people. Try and, even if it is to have a schedule where you just know that, okay, I'm going to make a phone call every day or make a phone call every 2 days or every weekend. Try and be proactive, not to be lonely, because unfortunately for people that are depressed, socializing is also very difficult. They want to keep to themselves. They don't, it's difficult for them to really, muster enough energy to say, okay, I want to do this. But at the same time, putting yourself in that position also continues to perpetuate the depressive symptoms that you have, So it's very, very, very important that we, as much as possible, watch out for that and try to guard against it as much as possible. Another thing we definitely need to look out for is that, as much as possible, we need to recognize, triggers, things like we've been able to see, okay, the symptoms and things like that, as much as possible, things that put us in a vulnerable position, if I may use that word. I mean, we all know ourselves, things that put us in a vulnerable position or make us feel more negative about things. Is it about maybe news or whatever it is that kind of gets you down persistently? I have a few friends that have said, oh, I'm just not on WhatsApp anymore. Blah, blah, blah. I mean, that might sound drastic, but sometimes people just know themselves because they want to guard their heart, if I may use that word, that phrase. They want to just be sure that they guard themselves from news, even though at the same time you have to still not put yourself in a position where you're not socializing appropriately. So it's very important for us as as people to recognize those things that easily get us down, those things that easily make us vulnerable, and try to mitigate against it as much as possible. So in terms of treatments, like we've said, we've recognized all these symptoms. Okay, now you're having those depressive symptoms. So what next? What do you do? Do you just kind of just keep it to yourself, or what? The first thing to recognize is, okay, if you feel that you're having any of those mild symptoms, it's best to have someone else that is a professional, maybe like a family physician, for example. That's always a very good place to start. It's always nice to have someone like if your family's physician, maybe to see you, take a history, and just be sure, because like I said, there's so many other things that they might need to rule out. For some people, if you have a family history of the thyroid disorder, the doctor might want to just do some blood work and say, oh, are you depressed because your thyroid hormone is low? So it's not always something that is your fault. It could just be that there's just that going on and needs to be checked. So it's always a good point of, that's always a good place to start with your family physician. Tell your family physician, let them do the test, let them determine what's going on, let them know, oh, is this mild, is this a moderate form of depression, is it something that is really severe and this person needs to go into hospital. So for mild depression, many people, they might not even need to take medication. So it might just be that, oh, they just need counseling, like psychoeducation, in the sense that, oh, you just need to understand what is really going on. What's wrong with me? Why am I feeling this way? And then that way, say, for example, you're not sleeping well, the doctor can, advise you, or maybe just have a sleep schedule. Instead of going to bed at 11 p.m., try to go to bed at 9. It could just be very, very practical, advice that you can just help to, change the situation. So, and like I said earlier, the earlier things are treated, the best, because you don't want to really go observe that you're mildly depressed and then watch yourself progress until when things are really severe and you have to be admitted in hospital, because you can, as much as possible, try and nip things in the bud, as much as possible. So psychoeducation, you might even need counseling, especially for maybe people that have adjustment disorder with depressed mood. Like I said, maybe things are going on, relationship issues, you need just maybe yourself and your partner, you need family, you need a marital counseling, there's something going on in the family, you need a family therapy, you just need some intervention with counseling. That's a good time to seek counseling and get it sorted out. And sometimes it might just be having an exercise routine, because exercise has also been researched and it does help as well to maintain a very healthy lifestyle does help. So it might just be having like 30 minutes of exercise a day, having a good structure in your day. It might just be very practical suggestions that you need to be able to get out of that mild depressive episode at that point. And then for people that have, like I said, seasonal affective disorder, there's what we call like a SAD lamp, seasonal affective disorder lamp, SAD light, for bright light therapy. People can get it in the pharmacies. Usually you just have the bright lights device, and you can, I know some pharmacies loan it out. If you feel, okay, this is too expensive, I just want to try it and see whether it works for me. So you can get it from a pharmacy and then use it every morning for like 30 minutes, sit in front of a bright light, and then the pharmacist can walk you through. But I won't advise you to just go straight to all of this, any of this, until you have had someone check you, in terms of have like a family physician see you. So this is not like a consultation session or anything. I'm just kind of putting it out there so that you know that you don't even, it might not need that you need to have medications, because some people, the thought of even taking medications for mood is very scary. So there's some other things that can be done. But once you allow things to kind of linger and then it's very, very severe, there's a high likelihood that then you'll be prescribed medication. So the earlier the better. And with medications, they're called antidepressants. They, like I said earlier, they help to correct the chemical imbalance in the brain. So most people, the family doctors can definitely prescribe antidepressants if they feel that, oh, this person is clinically depressed and this is not just a mild form. There's a strong family history, there's a past history, and they need to treat it, especially for people that have like postpartum depression. You understand, we always try to treat it as aggressively as possible, because we know that if it gets worse, then the mom cannot be able to take good care of this new baby. And, there's always a ripple effect with that, So there are different types of antidepressants in the markets, different types of classes of antidepressants, that sometimes it could be, for some people, you might need to start one. If it doesn't agree with you, the doctor might start another one. It's fine. It doesn't mean, oh, this is really hopeless. No, it's just that sometimes some people just react better to one medication than the other, and it might take some time for your doctor to kind of discover which one works for you. So it's very important that you work with your physician, whether it's your family doctor, and if your family doctor feels, okay, this person really needs to see a psychiatrist, then they refer you to a psychiatrist, because sometimes there are other things going on. It could be that this person has a lot of other physical issues going on, and they have to be careful which medications they need to start with, or they just need that second opinion that, oh, they want a specialist physician to look at it. So being referred to a psychiatrist doesn't mean that, oh, okay, now I'm with the shrink, this is the end. I don't think, at least I'm a psychiatrist, I don't think I look that scary. So I think people should feel very comfortable. If you feel that, the doctor says, oh, you need to see a psychiatrist, it's not the end of the world. It's not a death sentence. It just means that the doctor feels that you need a specialist. And usually a psychiatric consultation, the first time sometimes maybe up to 45 minutes, because the doctor takes a lot of history. They have to take a history of what's been going on, do you have any medical issues, what's happened in the past, it's always a very extensive assessment the first time, and the next time things maybe quicker, so that way the psychiatrist can know how best to help you at that time. So then, like I said, the medications is one. Then we have, apart from just counseling, like I've mentioned, there are some evidence-based talk therapies, for example, like cognitive behavioral therapy, that have been researched that they do treat depression. So it's not just like regular, oh, how are you doing? Everything will be fine. No, it's very structured. Sometimes the therapist will give you homework. The therapist needs special training to be able to carry out those kind of therapies. So the doctor can refer you for cognitive behavioral therapy or CBT. The other ones, like interpersonal therapy, say, for example, you're finding it difficult transitioning from one role in life to the other, God forbid, maybe for some people that maybe were married and not married anymore, or now you're now a new parent, and it's really a challenge to transition to that new role, and it's causing the depressive symptoms to perpetuate. Interpersonal therapy can be one that you can be referred for. And then for some people, they've tried medications, and things are, maybe they have challenges with medications. It could be side effects. It could just be that they have treatment-resistant depression. There is definitely treatment-resistant depression. There are other treatments like electroconvulsive therapy that we do, carry out, but that is more for very severe cases. Say, for example, the patient is very suicidal, and they're not responding to medication. So there is what we call, some lay people call shock therapy. So there is electroconvulsive therapy. They apply electric currents to the head, just so that to help juggle up this chemical imbalance that I talked about in the brain, and it is very, very effective treatment, 85% success rate with ECT. There's also rapid transmagnetic stimulation, RTMS, which is available as well, although that's more available privately, because for those of us in Ontario, OHIP doesn't cover RTMS, so you have to pay privately. So there's a lot of treatment that is available. And the first step, like I said, get to your family physician. The next step, the family physician decides, okay, are we going to treat this? Do you just need counseling? And if the person feels, the doctor feels that you need to be referred to a psychiatrist, then that's like the next level of treatment, and everything, depends on what the outcome of the assessment is. Then the treatment plan is formulated with the patient. There's also, I know that there are alternative therapies available, like some vitamins, like St. John's wort and things like that, that people use, maybe for mild, moderate depression. The disadvantages of this is that, unfortunately, a lot of them have not been thoroughly tested in terms of evidence-based research and things like that, because of the challenges of measurements. So unlike maybe like your regular pharmaceutical pill, if you hold a pill, this is 10 milligrams of this particular medication. But sometimes with herbal remedies, it's difficult to know that, okay, if you have this, what exactly is contained in it compared with the next pill. So a lot of times we just advise people, see your family physician, explore what you need to explore, evidence-based treatment as much as possible, because sometimes with herbal remedies, with alternative therapy, it might be difficult to really, quantify what exactly you're taking at that time. So, like I said, recognizing triggers is very, very important. In the world that we're in now, we have no excuse with educating ourselves. There's a lot of evidence-based information on the internet, and at the same time, there's negative information that is not, you shouldn't really go to, because it's going to make things worse for you. So I always advise people, research on the illness you have, educate yourself, know what it's all about, but make sure you're on websites that have good credibility. Like in Canada, I always encourage people, there's the Center for Addiction and Mental Health, that's the CAMH, is a tertiary mental health facility here in Ontario. They have a lot of resources online for families, for patients, that very easy to understand, that you can, that when you read it, you are getting good information, So CAMH website, CAMH website is a good one to go to. Then there's also the Canadian Mental Health Association, CMHA, which people can self-refer to. You can go in there, get resources. There's always usually a CMHA office in every locality. There's also a lot of information on the CMHA website for mental illness that you can get education for, not just for yourself, but for even your family members. Then as well, apart from being an expert yourself in terms of read and get education, it's also important you monitor your mood. For people that know that they are prone to having depressive symptoms, you can, what we call like a mood diary. If you go online and type mood diary, you see a lot of templates of mood diaries where you can just print, and then, you're able to monitor your mood and say, oh, especially for ladies, do you have like what we call premenstrual dysphoria? Like a few days before your period, you find that your mood is very, very low, but once your period starts, you're fine. That way, at least you can regulate and know, okay, this is when I need to really be careful. I need to sleep well and things like that. And, you understand yourself better. So it's nice to have a mood diary. If your doctor has, if there's a doctor has prescribed medication, try and comply with the medication. If you're having problems with the medication, instead of just stopping it abruptly, talk to your doctor about it. Because one thing about antidepressants is that we advise that if it's going to be discontinued, even if a doctor is discontinuing it, they don't just stop it. It has to be weaned off gradually, because there's what we call serotonin discontinuation symptoms. It can be quite uncomfortable. So I won't advise anyone to just stop their medication and say, oh, I'm not taking this again. Then you find that you're even having more unpleasant symptoms. And of course, sleep is very, very important. Like we've seen, try and have a very healthy sleep hygiene. Don't take coffees at night. As much as possible, avoid stimulation, like watching TV in your room at night, things that will keep your brain awake, if I may use it like that. And there's some other things that can help you relax. If you know for yourself, or if I take a warm bath, I feel more relaxed in the evenings and I'm able to sleep better. Sleep is extremely important for people that have depression. And then as well, it's also very important to have like a balanced life as much as possible. I know, especially in this world we live in, it's so easy to be wrapped up with work and things like that. And then now, unfortunately, with the social isolation or physical distancing and things like that, a lot of places are closed. Some people find that going to the gym is always, helpful for them. But there are other things you can do, even at home, exercise at home. You can develop good hobbies, maybe things that that you were not really interested in, even if it's just something simple. Just have a new interest, something you can divert your attention to, something you can enjoy, and you're just out of your normal routine. And then for people that have severe depression or moderate depression, it's always nice to have like a crisis plan and know that, okay, if this happens, this is what I want to do. Say, for example, this is what I'm going to do. You have your phone numbers ready. Here in Ontario, we have like crisis helpline numbers that you can call, maybe like 24, it's always open 24/7. Like even if it's in the middle of the night, if you feel, okay, I've tried everything and I still feel like I'm in a crisis or I'm feeling suicidal, before taking that pill and taking an overdose, you can call a crisis helpline number, speak with the professional. It's confidential. They can talk to you. If they feel they need to take necessary steps, they will take it. So everybody should, people that have like moderate to severe depression and even mild depression should always have a crisis plan. If things really get worse or get bad, what do I do? And it's nice to share this with your family as well, so that everybody knows that, oh, people that are close to you, they know that this is it. If we start seeing this sign, then this is how we can help you, so that people don't even make things worse for you, criticizing you and making you even feel worse. So overall, there is help available, definitely. There are resources. There are also some apps you can download on your phone that, can help. Like, I think there's the Abide app for Christians. There's the Headspace, which is not really faith-based, but has a lot of evidence-based um, coping strategies and self-help that you can get. So if for a lot of us have like phones that we can download apps, whether on Google Play and the App Store on our phones to help. So it's very important that, as the times are changing, we have resources that we can use and, to our advantage as much as possible. And then as Christians, even there's as much as possible, I had shared before, prayer also helps. I won't finish this without mentioning prayer as much as possible. And it's evidence-based as well. There's a research that was done in Harvard a few years ago, and they did a research on 7,000 youths. So they got 7,000 youths and they kind of put them in different groups. And then they found out that they followed them over like an 8-year period and then 14 years afterwards. They found out that prayer for the children that were praying every day, and as they grew up to be older adults, that there was less, less risk of depression in them. They had a better self-esteem of themselves, and they were more satisfied with life, So this has also been researched too. So I'm not just talking about, let's just pray about it kind of thing, but it's also part of what would help us, especially for us that are Christians. Okay, I think at this time it would be nice to, if anybody has questions.
Thank you so much, Dr. Adekande. You have done an amazing job telling us treatments and where to start and how to seek help and what to watch out for. So we want to say a very big thank you. We got 2 questions during the course of your presentation. Somebody had asked, how do you help someone who's in denial that they are depressed? That's one. And number 2, that antidepressants can make you worse or sluggish. Can you speak to those 2 questions?
Okay, let me see. The first one, you said, can antidepressants make you sluggish, or?
Yeah, can they make you sluggish or make you worse? And the other one says, how do you support a friend who's in denial that they are depressed?
Okay, let me start with people that seem to be in denial. Like I said, psychoeducation can help in the sense that even when we have patients on the ward, people that are brought in on maybe like on a form, like when somebody is brought in on a form, means that they don't want to come to hospital, they don't see anything wrong with themselves, but they're in danger. Maybe they really want to kill themselves, and they find that, they find them in the hospital, So where do you start from as a doctor? Because this person doesn't think they need to be in hospital. The key thing is psychoeducation. So like we can give these friends or these family members information. Why not read this and see if anything in this document or pamphlets relates with you? You understand? So that might be a subtle way of starting to introduce you to that person. And then maybe by the time they read it, and it depends on how close you are. Say, for example, if it's a distant friend or a parent or something, you can then say, okay, I've noticed this in you. Don't you think this is a symptom of depression? Or even if you don't believe me, why not just book an appointment with your family physician? So you will get people that will definitely be in denial. They don't see it because they don't have that insight that something is wrong with them. And the risk of getting worse is definitely there because they are not they are not seeing it, even though everybody else sees it. So definitely, I think that the first place to start is psychoeducation, in the sense that providing that person the information that might not be just from you saying, oh, you have this, you have that, but something else that maybe on the website or printed and present it to them, and then they can read it and they themselves can see. So that's always an initial place to start. And you will still find people that might say, no, I don't have this. It's more difficult, really. It's a challenge. But at the same time, pointing them to their family physician might also be a good place to start. Then the second question about medications. Yeah, so like I mentioned earlier, there's so many different antidepressants that are on the market that are good. The thing about antidepressants is there's no antidepressant that is better than the other. They all have the same efficacy. There's no like, oh, this one works better than the other. They've done a lot of research and everything works the same. The only thing is that sometimes some agree more with some people. There's some that maybe some people feel that, oh, when they take it, they are prone to weight gain more than other people, or some of them, you just find out that maybe you're more sedated than before, than others when they take it. So one of the things we do is, say, for example, if you take your medication and you feel, oh, this is making me so tired, then we prescribe it at bedtime. So that way you get your sleep and you're taking your medication at the same time. But if the side effect is so severe that you can't really function, then you might need to talk to your family physician. That might be a good time to say, okay, let's change this to something else and let's try something else that would help you. So I wouldn't say that all antidepressants make people sluggish at all, because they're supposed to give you energy for those of them that are very tired. But if you're having significant side effects to a medication that has been prescribed, that's not a problem. Just discuss with your doctor, and then they might walk around. It could just be that the dose is too high, and then they just reduce the dose. Or they might say, okay, let's try something else. And like I said earlier, it's not wrong to try a few things that is, under supervision, because sometimes you might not get the right one the first time. I hope I answered.
Yes, thank you very, very much. And just looking at the chat, I saw a quick question. In a minute, can you speak to chromotherapy and aromatherapy and how it could be used as a treatment for depression?
Okay. So like I mentioned, aromatherapy and so many alternative therapies, definitely there will be some, it depends. I'm not sure what particular product the person is referring to. So it's difficult for me to just generalize and say, oh, they're good or they're not good. You understand what I mean? But I'll just talk in general terms, in the sense that a lot of things have, are on the market. Like I mentioned a few earlier on. Something like lavender oil, definitely a lot of people find it soothing, but I won't say it will treat your depression. Like I mentioned earlier, it could just help you relax and then you sleep well at night. But that's just part of the story. There's so many other things that go with clinical depression, So some of them might just be for symptomatic relief. When I say symptomatic relief, like, oh, say for example, your appetite is not good, you're not eating well, then you take something that just to help your appetite. Like some people might even drink like Ensures or things like that, just to boost their, at that particular time. So it's just kind of helping a symptom of what is going on at the time, but not necessarily treating the whole depression, So it depends on what exactly product we are talking about. But in general terms, I would say that any of these alternative therapies that you want to explore, be it aromatherapy, be it herbal remedies and vitamins and things like that, just run it by your family physician. Some of them just would boost energy, like, and like even CoQ and a lot of other vitamins like that can help your concentration, fatigue and things like that. But the core depression still needs to be treated, not just symptoms being relieved. I hope I answered.
Yes, you did. And I just want to say a big, big thank you to Dr. Adekonde. Thank you for doing justice to this topic. I know, people will have questions, but we can't exhaust all the questions on this platform, but I know you have steered us in the right direction for as many of us that have questions, for as many of us that are wondering, for as many of us that are not even bold enough to say, I might be experiencing this. And I know our backgrounds, for most of us who happen to come from maybe Nigeria or wherever, our background doesn't help too, because once you show signs of depression, or you even try to admit to it, you're considered as if you're losing your mind. I have a younger friend say to me that, what are you afraid of? Are you afraid that I'll be living on pills and stuff like that? And that could be true. That could be as a result of, stereotyping, experiences and all that. But we live in an environment, like Dr. Adekonde said, there is help, there are resources, and we shouldn't suffer in silence. There are different categories of depression. There's the mild one, there's a severe end. So it's like a spectrum. The earlier we start treating it, the better. And I'm so happy for as many Christians on the platform which I believe majority of us are, that prayer works too, but prayer in conjunction with every other thing that we might want to do. So thank you for everybody who has joined tonight's session. I hope you have been blessed one way or the other. And again, I can't thank you enough, Dr. Adekunle, for coming. Thank you for being a big support here. And yes, that's about the size of it tonight. Thank you, everyone. God bless you and have a good evening. And that's the end of a meeting. Before I leave, I think I can just share a quick word of prayer. Father, we thank you for such an opportunity to be able to deploy our knowledge to improve ourselves. For everyone, of God, who might be having symptoms, who might be having challenges with their mental health through depression or any other symptom, we ask for your healing power. Bible says you sent your word, you healed, and you delivered from destruction. We ask, oh God, that your healing power will reach everyone who is either predisposed or going through depression in the name of Jesus. Thank you, everlasting Father, because as we hand over our lives unto you, we ask that you will touch us, that circumstances will change, and that your name will be glorified. Thank you, everlasting Father. In Jesus' name, we have prayed. Thank you, everyone, for joining. God bless you.